Tell me about your symptoms before the surgery.
Well, before the surgery, I had just a lot of pain on my left pelvic side that was just really awful, and so bent over that I couldn't stand up decently.
How bad? One to
Yeah,
crooked.
You know.
Yeah, and we noticed you have a scoliosis actually.
Yeah,
That was your
yeah.
problem.
That
Now,
was it, yeah.
1 to 10, how bad was the pain?
Oh, sometimes 7, 8. I mean, it
How
was
far?
tough.
Yeah, how far could you walk? Walking, how was walking?
Not very far.
Yeah,
No, if we went to the grocery store, I'd have to kind of lean on the cart
Yeah,
to walk
yeah.
around the store. I couldn't just walk without it.
How long was it going on, this problem?
I don't think I can even tell you, but it's been a long time
Yeah,
What?
that I've suffered with that.
Oh, yeah,
Yeah.
it's been
I mean,
a couple of years.
at
Couple of
least
years.
a couple years,
yeah.
maybe.
Now, obviously, now I think you even saw another surgeon and
Yes.
that you had a scoliosis.
Yeah.
And what did he suggest to you? What to do? How to fix this?
Well, he said I'd have to have a surgery that was many hours doing that, you know, and it just scared me because
Yeah.
I mean, it just
Did-
seemed massive.
Scoliosis surgery, literally, many of my surgeon colleagues say that, if you have a scoliosis, you have to fix it all. And yours, I think the surgery you have been suggested, the scoliosis, thoracolumbar scoliosis correction, which put the bar pretty high, especially, in people your age. That can be very devastating to the body to go through a surgery like that with lots of complications. But that's not what we did. We did a segmental OLLIF. As a matter of fact, your surgery was not even 1.5 hours, and the blood loss was just few ounces.
Yeah, I can't believe it.
Yeah. How long did you stay in the hospital after
I
our surgery?
was in the hospital overnight. And went
Just
home
over the night, and next
afternoon, yeah.
And this is what we did. We did the L3 to S1 scoliosis correction, and here, in that area that we did the surgery, scoliosis is gone. You still have some scoliosis in the levels above, but your symptoms were coming from here. So that's why we decided just fix what giving you maximum symptoms. And here are the screws. Even though we did it minimally invasively, look at that. The screws are with double C-arm. We are able to get it right on. And I use really big screws because big
Yeah.
screws hold you better. And here it is. You see that screw is same size as the structure I did need to go through.
What's
And
that
this
screw going into?
through a part of the bone, we call it pedicle, and it has to be big because especially in elderly, when the bone is soft, we want to have more surface to catch on that. Now, how are you? How is the pain?
I feel fine. The
Yeah.
only thing is the leg pain drives me crazy, but
Yeah.
I mean, other than that, just a little soreness.
Yeah, but overall, that back pain is, you're telling me it's not,
No pain in the back.
yeah. How is walking?
Walking is pretty good.
Yeah.
Yeah,
So
walking.
overall, was it worth it so far?
Yes,
Now,
very much.
the leg pain you're noticing is that, that is actually from us pushing the nerve to the side to get in.
Okay,
And usually we are just barely 4 weeks out of the surgery.
that's right.
So, meaning that, it's going to get better. The prognosis of that is fantastic. But then the upside of the surgery is that we don't have to fillet you open and massacre your back to get the job done. And as you notice, you're getting better, but it's just healing is still ongoing. This is the first post-operative visit. So we have a long way to go, but we are on the right track. And, obviously some physical therapy will help you as well.
Okay.
So what question do you have for me?
I don't right now, I guess.
So?
You answered a lot of them.
Thank
We're
you.
happy with it.
Thank you. And what do you notice when she walks or does things daily?
Well, she's very careful about even walking
Mhm.
around the house because I suppose it's because she doesn't want to do something wrong that
Yeah.
would
Yeah,
injure something.
absolutely, absolutely. But
So-
overall, what do you notice, regarding walking or activity? Do you notice
Oh,
any difference
she's-
to before the surgery?
Our granddaughter came out one day after, she said, "Grandma, what did you say again?"
Grandma, you're taller.
And
She said
actually,
straight up.
when we are young, the discs are more inflated. So we are taller. When we get older, especially in your problem, when the disc collapse, we get shorter. What I did, I'd restored part of the disc height. So you're truly about an inch, sometimes even 1.5 inch taller, because I jacked them up, and that is how we take the pressure off the nerve, by restoring the disc to the normal height. And people tell me that, well, I even measure that. I'm an inch or 2 inch taller. Well, obviously, we don't do the surgery to make people taller, but by jacking up the discs, restoring the original height, that is actually what we take the pressure, how we take the pressure off the nerve.
Yeah.
By restoring the spine the way it's supposed to be. We call it anatomic or physiologic decompression. And here you are, it
Yeah.
works.
I feel taller.
Yeah.
So what did you fill in with it? I mean,
That spacer, that titanium, that metal,
okay.
that spacer that, lift it up and restores the height of the disc. Yeah.
Okay.
And because it's metal, it just stays there.
Okay.
There's no way that, that area, once it grows back, it just stays in that height. So the height is restored permanently.
Okay. That's
Okay.
great.
Yeah.
Okay.
Well, thank you so much for the interview. I appreciate that.